Hi, everyone. Thanks for joining today. My name is Selena, and I'm a Human Resources Analyst with the Benefits Division. I want to go ahead and give you a formal announcement. So first, thank you for joining our virtual open enrollment seminar. At this time, we will go over SIMNSA medical benefits for the plan year of 2026. Before we get started, I would like to make a brief announcement to everyone on some housekeeping items. All attendees are muted and will remain muted throughout the presentation. If you have a question, please type it in the chat located on the right side of the presentation screen. Be informed that if you type a question in the chat box, everyone attending the session will see your question and your name. If you have a question that is sensitive or confidential, we recommend that you reach out to the County Benefits Division or your department's benefit ambassador directly. Lastly, today's seminar is being recorded. A copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Matt Ogden from VIBA, to make a brief announcement and then discuss what we will be sharing with you today.
Thank you so much, Selena. I appreciate it. Good morning, everybody. Thank you so much for joining us here today. My name is Matt Ogden, and I am an account manager with VIBA, and actually your dedicated account manager for the County of San Diego. So today we're going to discuss your open enrollment for the 2026 plan year. With today's agenda, we are going to talk about what's going to be changing for 2026. There are a few minor changes that will be impacting you, and then we're going to go over the SIMNSA plan. We have our SIMNSA rep here to discuss the SIMNSA plan and all the benefits that are available. After she talks about the plan, then we're going to go ahead and talk about some of the expanded access resources that you have being a VIBA member, as well as some of your well-being resources and additional benefits. If you do have any questions at any time, as Selena had mentioned, please feel free to put those into the chat. We will make sure to answer and stay on for all of your guys' questions. So first, I always like to start out with who or what is VIBA. So VIBA is actually a nonprofit trust that provides medical, dental, and vision benefits for a lot of different groups, with the County of San Diego being one of those groups. And when it really comes to your healthcare, your health, our purpose is our motto. What it really means is we want to provide you guys with the absolute best healthcare that is available at the most affordable cost. So we are always looking at ways where we can save in healthcare dollars and really provide you guys with, the absolute best benefits that there are. So your health, our purpose is our motto. You guys are the focal point in everything that we do. We want to make sure that we are giving you the absolute best care. Our vision is at California Schools VIBA. Our vision is to have all Californians have accessible and equitable healthcare, and our mission is to build strong communities through healthy, engaged, and emboldened membership that enjoys a total state of well-being. All right, with that being said, let's go ahead and talk a little bit about what's going to be changing for the 2026 year. This is going to begin on January 1st of 2026. So the major change that is going to be happening for the 2026 plan year is that the infertility coverage is going to now be embedded into your medical plan. So this is a California mandate, also known as SB 729, where all fully insured medical plans now are required to offer fertility and the diagnosis of fertility embedded into your actual plan. So what does that exactly mean for you? Meaning infertility benefits are going to be covered in your SIMNSA plan moving forward. So you will actually go through SIMNSA if you are looking to grow your family in the 2026 plan year. So what does that look like for you guys as SIMNSA members? So a couple years ago, we introduced what was called KindBody. KindBody is a fertility solution benefit for folks that want to be able to grow their families. There was no coverage under the SIMNSA plan before with regards to infertility coverage. And so VIBA stayed ahead of the curve by partnering with KindBody for any members that wanted to grow their families, then they could have infertility coverage through Kindbody, and VIBA would actually pay and sponsor one full kind cycle. So that was one round of IVF or one round of IUI, and this was a lifetime benefit that you could access. So that was paid for and sponsored by VIBA. Now moving into the 2026 plan year, infertility is going to be covered under your SIMNSA plan. So there's no need to continue our partnership with Kindbody for infertility services. So infertility will no longer be covered through Kindbody. If you want to access Kindbody in the 2026 plan year, you can. You still get a 20% discount, but it will not be, you will not get that one full kind cycle or that round of IVF or IUI at no cost. However, we wanted to go ahead and continue to partner with Kindbody because there's a lot of additional benefits that Kindbody has to offer just besides the round of IVF or the round of IUI. And that was a lot of additional service like their holistic health services. Menopause support was also another benefit that was available in the 2026 plan year. We know anybody that is going through menopause, this is a very difficult time for an individual. And Kindbody does a really good job at providing support, and that is in a virtual setting. In 2026, though, we are going to add a couple enhancements with Kindbody. So these are automatically going to be covered through Kindbody that are covered at 100%, and that's going to be Kind Man, Kind Doula, and fertility preservation. So these were not included before. Kind Man, so there was really no coverage through Kindbody on the male side when it comes to infertility services. So moving forward, there are male diagnostic and male fertility services known as their Kind Man program, where these will be covered if you are looking to grow those family and you need services on the male side. Kind Doulas is a virtual program that offers additional support with any families that are going through the pregnancy process. Again, this was not covered in the 2025 plan year, so in 2026 it will be covered. So virtual care, the virtual care services with one of the doula specialists, you're going to get 8 sessions. So any families that are going through that pregnancy process, they want that additional support, you can get 8 virtual sessions. If you want an in-person doula specialist to be supporting you during the pregnancy process, then you would be responsible for that cost on your own. But we will provide you with the 8 virtual services at no cost to you. And then finally, fertility preservation. This is not embedded into your SIMNSA benefits. So if you want to have your eggs frozen or your sperm frozen or your embryos frozen, then VIBA will pay and sponsor the first year of that preservation. Any additional years that you would like to have these services or your sperm or your embryos or your sorry, I lost my train of thought. Have any of these services preserved in multiple years, then you will be responsible for paying for it out of pocket. I want to say the going rate now for egg freezing is about $900. So there is a continuity of care. So if you have any members that right now are currently accessing Kindbody in the 2025 year, they're going through the infertility process. Let's say that continues into 2026, then that will carry over into the 2026 plan year. And we will actually cover through that first quarter. So that is basically till the end of March of 2026. You will receive that continuity of care that will transfer into the 2026 plan year. We will continue to still cover that first kind cycle or that round of IVF or IUI. So if you're looking to grow your families in the 2025 plan year and you are going through Kindbody and it carries into 2026, then you will still have access to the Kindbody program. If you decide to wait till 1/1 of 2026, then you will actually go through SIMNSA because this will now be embedded into the plan, and SIMNSA will be able to assist you with your infertility quest. So really just a recap of what's going to be changing for the 2026 plan year. So for those of you enrolled into the SIMNSA plan, if you are looking to grow your families in 2026, you will now go through SIMNSA for any infertility treatment and diagnosis. However, you can access KindBody for the additional benefits that I had just mentioned. With that being said, we're going to go ahead and discuss your 2026 available benefits. So this is going to be your SIMNSA plan. And in order to talk a little bit more about SIMNSA, then I'm going to turn it over to Esmeralda Beltran, who will talk about how the plan works. Esmeralda, it is all yours.
One second, Esmeralda, if I could just ask Matt a quick question, a clarification
Of
question
course.
coming from the chat regarding the fertility treatment. For those who do plan on enrolling in SIMSA, since it is located in Mexico, do those services need to be performed there?
Esmeralda, is that something that you're able to answer? I believe the answer is yes.
Yes, that is correct. Since our network is in fact in Mexico, where all of our providers and specialists for fertility are in Mexico, then all of these services would in fact need to be performed there. Correct. So the answer is yes.
All right, thank you both. Just since we were on the topic, I wanted to get that question in there. But yes, Esmeralda, please take it away as Matt mentioned on the next portion.
Thank you, Selena. I'm still not able to turn on my camera. If you someone wants to give me access to that, or should I move forward without the camera? Matt.
Yeah, move forward. I'll play around a little bit with the settings and see if we can get the camera on.
Wonderful. Will do. Well, thank you, everybody. Good morning. Thank you for taking the time to join us today for this open enrollment meeting. My name is Esmeralda Beltran. Again, as Matt indicated, I am with the SIMNSA Health Plan as your dedicated account manager and open enrollment engagement specialist. And I'm going to be walking you through our health benefit options for the upcoming open enrollment period. Thank you so much. We do value our partnership with the County of San Diego and of course with VIVA, and we're excited to continue providing quality, high quality, of course, affordable and accessible care to you and your families. During today's presentation, we'll review who, again, SIMNSA is, what makes us unique, the benefits and coverage, and some of our updates for this year's open enrollment year. Thank you. So SIMNSA, what is SIMNSA? The SIMNSA HMO plan is the first and the most comprehensive cross-border health plan licensed with the California Department of Managed Healthcare. We are the largest provider network in Northern Baja California with over 600 board certified providers in Mexico. We have 3 convenient locations for cross-border population. One of them is, of course, walking distance from the U.S.-Mexico border in San Isidro, which is where most of you will access care, the closest network in San Isidro, and in Tijuana, which includes our Tijuana network. We have also a network in Mexicali, if you happen to be in that area, in the Calexico, Mexicali area, and a smaller network in Tecate. All of care is rendered in network in Mexico, as I mentioned, and SIMNSA again also offers coverage anywhere in the world for both emergency and urgent care. Next slide. With our SIMNSA HMO plan, there are a lot of things you can do from our website. You can visit our website at www.simnsa.com for more information, including how to access our providers. We have a list of providers on our main page or homepage from the website, our summary of benefits. We have the evidence of coverage as well, if you want to review all of the stipulations. Some of our forms, wellness information, how to view your My SIMNSA Health and view your medical records. You can view your lab results. You can schedule appointments as well. And most recently, we've also created our own SIMNSA app. So here you can download the SIMNSA app on your, whether it's an iPhone or a different, if you have a different carrier as well, you may also download the app, the SIMNSA app there. Thank you. Next slide. So with our integrated health system, we have a one-stop shop medical campus where we offer a comprehensive range of healthcare services, of course, all located within the same medical building. Our commitment to excellence is reflected with our interconnected network of our clinics, which is designed to provide quality and efficient healthcare where all of our doctors can access our electronic medical record system to provide an overall and robust medical care. Next slide. So searching for a provider is made very easy to our members to find a doctor, a hospital, or our labs at our SIMNSA campus in the network at simnsa.com. You can just follow these steps. You go to www.simnsa.com. From the homepage, you'll select provider and facilities and click on provider search. You're either going to search all to see all providers, or you can specifically click on the Tijuana network, and then you will be given all of the list of the doctors in that network, including all of our PCP doctors and or specialists, and you'll be able to even view all of the pharmacies in our network. We have 2 pharmacies we contract with in the same building at SIMNSA there called Pay Pharma, and then there's also a list of other contracted pharmacies that we contract throughout the city of Tijuana that you can also, which are most commonly the Farmacia Roma are the most commonly used also pharmacies there that we contract with in Tijuana. And you can see those at every block or every 2 blocks. There's many pharmacies in Tijuana that we contract with. Next slide. Just to give you a snapshot and an overview of our benefits and the SIMNSA HMO plan, you can see there on the left-hand column on the benefit summary that it's a very unique, very rich plan. There is no deductible, no co-insurance. Our medical out-of-pocket maximum per individual on the County of San Diego's plan is $6,350. Per family, it is $12,700. It is very highly that medical out-of-pocket maximum will be met because the co-payments are so low. There's a $7 copay when you visit your PCP for your office visit, as well as your specialist office visit. It continues to have that same $7 copay. For preventative care, there is no charge. Remember, you can get all your preventative care, all of your screenings for women, for men, at our medical campus there at no charge. So definitely, please take advantage of doing your annual wellness exams every year, your physicals. I know my son is actually getting his physical now at SIMNSA. He's 19 years old. He loves the plan. He's an adult, although I wish I could be there with him. He feels very confident, very safe when he goes to his appointments as well. For inpatient hospital care, there is no charge. Now let's mention urgent care. For urgent care within our network at our hospital remains open 24 hours a day, 7 days a week. There's a $25 copay at our hospital in Mexico. And there is out of Mexico within the San Diego County, or if you're visiting elsewhere in the United States, there's a $50 copay with any urgent care that you visit. It's important that you take your SIMNSA health insurance card so they can recognize your plan and your SIMNSA member ID. For emergency room, that is also a covered benefit. If you have a life-threatening emergency, there is a $250 copay in or out of the plan area. If you are in the US and you are going to the hospital, whether it's Sharp, Scripps, and you are admitted into the hospital, then that $250 is waived. Once you are stable enough to be transferred to our hospital in network in Tijuana, then our medical team in Tijuana will be speaking to the hospital and the case manager so that we can arrange that transfer, and then you will be transferred, the member will be transferred to SIMNSA Hospital to continue with recovery and or treatment. You are discharged the same day when visiting the hospital, then that's where that $250 copayment will incur and will apply. Okay, wonderful. For short-term prescription drugs, you have there is a copay of $10 per medication. Unfortunately, we do not have a mail order delivery prescription program. So all SIMNSA members will have to fill all prescriptions in Mexico in network at one of our pharmacies at the SIMNSA building or our contracted pharmacies in Tijuana as well. We have, again, all of our medical centers are in Tijuana, Mexicali, and Tecate in Mexico. Our clinics are open 6 days a week, Monday through Saturday. Our one-stop clinic is where you can receive all your medical services and where all your medical services can be rendered. We also offer telehealth services with our SIMNSA doctors and specialists. With your applicable copayment of $7 as well, you will need to visit telemedicina.simnsa.com so that there you can access, and there's instructions to go ahead and set up that telehealth virtual call. Next slide, Matt. Thank you. We are very, we continue to support all of your health and wellness at SIMNSA because your well-being is our priority. At SIMNSA Healthcare, we're committed to promoting all of our prevention and preventative. We have campaign programs and comprehensive healthcare where you can discover all of our tools and resources specifically designed to support your health and your wellness journey. We have health and wellness talks every Wednesday at our campus, sometimes even on Saturdays. And if you scan that QR code, you can view our full calendar of what those member talks specifically will be geared to or geared for that week. They range from emotional talks, therapy, how to, we have a nutritionist, how to take care of your heart, how to cope with stress at work. Just a full, robust talks that we like to have them in person at our medical building. You just choose the event that interests you. You can register online through the calendar or just join directly. It's open to, if you're at the SIMNSA Medical Campus, you can just join. It's open to the public. If I'm in an appointment, and sometimes I see on Saturdays that they have these wellness talks, I will stay and I'll remain for that, those talks with the doctors for about an hour. They're very, very helpful. You can also follow us on social media to stay updated on all of our preventative care campaigns and just community events on Facebook, on Instagram. We'd also like to mention that there's a medical spa at SIMNSA called Dermalife. So it's our medical spa where this is actually a covered benefit. You can enjoy and access our massage therapy as a covered benefit with a $10 copay. All you need would be a referral from your primary care doctor, and that way you can also schedule your appointment. I've done this. This is where you're being, you have a lot of maybe stress at work, maybe you have some pain, and there is this massage therapy massage that is included with your $10 copay. It's a 40 to 50-minute massage. It is wonderful, and depending on what your PCP doctor recommends, you can have it, anywhere from 1 to 4 massage therapies, as well as we have the acupuncture is also a covered benefit as well with a $10 copay, and that would be also on the 4th floor, and it applies again with a referral from your primary care doctor. Next slide. On GLP-1 medications, we know that recently there's been it's been a hot topic, and we have some current indications, and I wanted to actually kind of give you or discuss this on its own slide, just because it's important to note that for GLP-1 to receive these type of therapies, we have 4 approved indications with our SIMNSA health plan, with dosage depending on each of the patient's condition, which includes weight management, treatment of diabetes, cardiovascular risk reduction with patients that have heart disease, and most recently we've approved it for non-alcoholic, fatty liver disease. So just to mention also, before initiating any GLP-1 treatment, we would like to mention that the patients with obesity are first supported through our metabolic syndrome clinic, where here we work closely with the nutritionist, or the member works closely with the nutritionist and a psychologist to ensure that you're getting the most comprehensive approach to weight management and overall health. So you will be speaking with the nutritionist, a psychologist, to go through a series of other steps before the GLP-1 medication is given to you, and only after completing this evaluation will GLP-1 therapy considered appropriate. So everyone is on a member per member case scenario, depending on your evaluation by the doctor. Thank you. Next slide. We also have a SIMNSA Sentry reimbursement program. And for this type of reimbursement, this is not on renewals. It is obtained by following these requirements. It is for those that are applying for Sentry as a one-time. When you receive your Sentry application, you first would submit your written application online. You must attach the following information with your application. When you do receive the Sentry card, a legible copy of your Sentry card, legible copies of payments made for the initial appointment, and once the Sentry card has been approved as well, for the subscriber only, not for dependents. This, I see that there's a question in the chat. Does it include global entry or only Sentry? This would be only specifically for the Sentry Pass reimbursement. And so these documents are then delivered to our administrative building on our 5th floor in our medical campus in Tijuana. And there, somebody on our administrative team will refund that, and it is processed within 15 business days approximately. And some information on the medical pass. I love to discuss this and give more information, because I know that those who live in San Diego, we drive, it's a short drive to our medical campus for our appointments. SIMNSA does provide a medical pass for those crossing the border when you have a medical consultation, or you are going for an ultrasound, a lab, x-ray. The availability, however, of our medical pass will depend on the amount of cars that are registered in the system at your time of your request, because I have often crossed, and sometimes there's absolutely no border wait to cross back. So as a result of this, the passes will be limited if there is no border wait. However, for when there is a border wait, which most of the time we know that there is, for members who are requesting this medical pass, SIMNSA does absorb the majority of this cost enforced by the municipality of Tijuana, because of course SIMNSA does not own these passes. We buy them through the government of Mexico, of Tijuana, and so the members, the SIMNSA members, are responsible for a $15 fee to obtain this pass. And these passes can be obtained at our customer service desk at the main lobby on the 2nd floor. That is where these passes are obtained. And then there they will ask you for your SIMNSA ID number again. And then you pay that $15 fee, and then you just provide your license plate number for the vehicle that you are driving, and then they give you a pass, a QR code, and then instructions and a map to be able to find that debt. And so on the return, when you were driving back, there's a dedicated medical fast pass or medical lane where you are coming back. And of course, you're saving so much time to cross back. So yes, correct. There's a question in the chat, and it says, just to make sure, the medical pass is an additional $15 fee. Correct. So when you want this medical pass and you'd like to cross back faster in the medical fast pass dedicated lane, then yes, that is an additional $15. Correct. Thank you. Next slide. So as I had mentioned, SIMNSA does in fact cover urgent care with our providers in the USA, specifically in the San Diego County. These are our preferred urgent care clinics that are most familiar with the SIMNSA cross-border health plan because they're so close to the border. However, SIMNSA urgent care, you can receive urgent care at any urgent care location. Because we are committed to safeguarding your health, whether you're in Mexico or in the US. So to secure that, we've established these partnerships with a network of these clinics within the San Diego County, some in Imperial Valley. And these clinics are the San Ysidro Health Clinics. And you can see that there's some in, I know there's 2 in Chula Vista, there's 1 in San Ysidro, there's a few. And on the website as well, you can find the list, or if you we also partner with the American Family Care Urgent Care Facilities, as well as the Mark Medical. And I know they're building more Mark Medical urgent care locations as well in the area of Chula Vista specifically. And we also partner with the All Valley Urgent Care if you happen to be in the Imperial Valley area as well. So we with these trusted partnerships, we ensure that you have access to these preferred urgent care providers, because you also save time and money, and you avoid that $250 copay for hospitals. However, again, if these urgent cares are closed, I know some of them close at 8 p.m. Again, if it's something life-threatening, you are covered at any hospital. You can go to any hospital as well. Next slide. And wonderful. So one thing I had mentioned before is that you now have access to download and have your digital SIMNSA ID card from your phone. You can view your card digitally if you download the SIMNSA app. Here, if you want to take a picture of that and scan that QR code there, you can download the app and register the SIMNSA app. Here you'll be able to see what plan you have, your copays, our customer service number, which is open and accessible to you for any type of question. We are available to assist you 24 hours a day, 7 days a week. Here on the app, you can also schedule appointments, cancel your appointments. You can view your lab results as well. There's a lot of neat things you can do. It's very user-friendly as well. So really, if you're a SIMNSA member or doing that switch over and you're going to be electing SIMNSA for the plan year of January 1st, then you can certainly download the app. It's really, really great. It's really easy and accessible and user-friendly to use. Wonderful. Next slide. And SIMNSA is, we have our customer service phone directory where you can call our 1-800 customer service member line at 1-800-424-4652. We are here to support your health every step of the way. You can call to schedule your appointments. Our call center operates again around the clock, 24 hours a day, 7 days a week. All of our agents are bilingual. You can ask questions, concerns, what time, up to what time do we stay open, any immediate situation you have. Remember, website is also available. So definitely you can certainly, we're here every step of the way to assist with any question or member need you have. I see a question here. So if I am visiting an urgent care facility in the US, do I have to do so? The copay for the urgent care facilities in San Diego has a $50 copay. The $25 copay applies at urgent care at SIMNSA at our hospital in Mexico. So it would be a $25, I'm sorry, be a $50 copay in San Diego because it's considered out of network, and $25 in Mexico, $50 for that urgent care in San Diego. I see another question. If I see a doctor outside of the network in Tijuana, could I still use SIMNSA for labs and pharmacies? So all of our doctors are in our network in Mexico. So we don't necessarily, you can't see a doctor here for primary routine medical care. We do not have doctors, only for urgent care would you be able to see a doctor. All labs to fill your prescription would be at our SIMNSA medical campus in Mexico in Tijuana. Okay, it says here, I have another question. Can the out-of-pocket be covered with the flex credits? Matt, do you know if you can help me with that question from our last, the last person that's asking?
As far as, can they use their FSA to pay for medical expenses?
I'm not sure if that's what she's referring to, because it says with her flex credits. Yes,
Selena,
she said no.
okay, I was going to say that might be a question for the county.
Okay.
Yeah, good question. So I'm assuming that in most cases, because the SIMNSA plans are affordable plans where an employee may have a lot of what we call excess flex credits, those leftover flex credits will pay for those premiums for the SIMNSA plan and any other plans that an employee chooses to enroll in. And then anything left over goes to something called a health reimbursement account. And that health reimbursement account is administered by ASI Flex, and employees are allowed to submit for reimbursement under that plan. However, there are certain items that are ineligible. One of those is prescriptions. So any prescription that is filled in Mexico, you cannot get reimbursed through your HRA, but there are other expenses that are reimbursable, like copays. So what I can do is I could put in the chat for you the contact information for ASI Flex. And if you have additional questions about what expenses can be reimbursed, you can contact them directly. But the one that I know for sure is prescriptions cannot be reimbursed through the HRA.
Thank you. Well, this concludes my presentation on SIMNSA. I think I'll I'll give it back to you, Matt. Thank you.
Thank you so much, Esmeralda. Yeah. Appreciate it. A lot of great information about the SIMNSA plan. So we're going to switch gears here just a little bit. I want to talk about some of the additional resources that are available to you and your covered dependents if you're enrolled into the SIMNSA plan. So this is at no cost to you. The first one's going to be with regards, yes?
May I interrupt for 1 second? This was probably discussed by Esmeralda, but I would like to ask one more time just for emphasis, because it's one of the most common questions we get regarding SIMNSA enrollment and emergency services when an emergency occurs outside of Mexico, but let's just specifically say here, since we're local in the US. Can you walk through exactly what would happen if a person experienced an emergency situation where they were admitted to a hospital, and what that transition would look like for them? What would happen in that situation? It's just an FAQ that we get, so it's worth emphasizing.
Absolutely. Wonderful. Thank you. Yes. So specifically, if it is a life-threatening emergency, the member will go to any hospital, in this case, anywhere that is nearest to them. If they call 911, that all of the ambulatory, or that from the ambulance to the hospital, that is also a covered benefit through SIMNSA. It is covered at 100%. For example, the member was putting their Christmas lights on, they were on a ladder and they fall. Their spouse or their children will call 911. The ambulance will arrive, just to give you a scenario. And the ambulance will be taking the SIMNSA member, will be taking the member to the nearest hospital. Once they arrive to the hospital, that member then is, triaged, of course. If that member is discharged that same day, then that's where the $250 copay on your plan will apply. However, if the member is admitted into the hospital because they had to stay overnight for any type of, they had a concussion and they had to stay to be seen by a specialist or a doctor, then that $250 is waived. If it's more serious, and again, they're admitted into the hospital and they perform an emergency surgery, then that is covered at 100%. Once the member is stable enough to be transferred, our hospital is in constant communication. Our SIMNSA hospital medical team is in constant communication with the hospital in the US, whether it's in San Diego, La Jolla. Once the member is stable enough to be transferred, they'll be releasing the member, he'll be discharged, and then they will be transferred to our hospital in Tijuana. So they will arrange that transfer in the ambulance, and then they're crossed into the border, and then SIMNSA is ready for them, and then they're taken to the hospital in Tijuana for any type of additional recovery, treatment, etc. That's how typically that works. It says, what about any scheduled surgeries that need to be done? Well, obviously, if you're evaluated by the doctor and their specialist, and you have a pre-scheduled surgery, those pre-scheduled surgeries are all done in our brand new hospital in Tijuana as well. So for example, if someone is having a C-section, that is going to be a scheduled surgery, and that would be done in our medical campus at our hospital in Tijuana, in network. I hope that answered most of the questions, Selena.
Yes, thank you. And then just for clarification, when for the postpartum and postpartum care, if for some reason an employee, just doesn't make it to a SIMNSA facility in time and gives birth here in the US, could you explain what the postpartum care would look like? Would they receive that in Mexico? And then just another question came in a similar question. So for pregnant individuals, pregnant women, must they give birth in Mexico if they're enrolled on the SIMNSA plan?
So yes, when you are on the SIMNSA plan, yes, I'd like to make a note that and advise that all of the prenatal, postnatal care would be with the doctors and gynecologists at SIMNSA. Correct. Now, only in a true life-threatening emergency, and the member is about to give birth and her water breaks. Again, I'm not a doctor, but that would be up to our medical director to review. But if it is a true medical emergency and the member needs to go to the hospital here, of course, sometimes you go to the hospital and you're only dilated 1 to 2 centimeters. So then you'll be evaluated at the hospital and say, so sometimes they'll be like, okay, we see that you're only dilated 1 to 2 centimeters. They check, the gynecologist will check the pregnant, the person who's pregnant, and then they'll say, okay, now you'll have to follow up with your doctor in Mexico. Or if it's a true life-threatening emergency and the baby has to be born here, then that medical director has 45 to 60 business days to determine whether it was a true medical emergency. But if it is a true medical emergency, then that is a covered benefit, and it will be covered at 100%. Yes.
Thank you for clarifying, Esmeralda.
Yes.
Right now, I don't see any other questions, and I just wanted to get that FAQ out of the way, and it sounds like it's a good thing that we did. So Matt, if you wanted to go ahead and continue with the other benefits, please take it away.
course. Thank you guys so much. Yeah, great questions today. Uh,
Yes.
So I just wanted to go over a couple of the additional resources that are going to be available to you in your covered dependents. So once you enroll into the SIMNSA plan, you'll automatically become a VIBA member. And so there are additional resources besides just what the plan itself has to offer that are available to you in your covered dependents. The first one's going to be our VIBA Resource Center. So the VIBA Resource Center we opened up back in 2019. Since then, we've gone ahead and expanded, and I'll go over the locations here in the next slide. But the number one question is, what is the VIBA Resource Center? What does it have to offer? And so really the VIBA Resource Center was designed to provide an alternative alternative approach to healthcare. So we know that healthcare is not one size fits all. What works for one individual may not necessarily work for another individual. So we want to make sure that we are here to assist you with whatever well-being challenges that you may have, whether it's physical, emotional, social, mental, it doesn't matter. We want to be able to provide you with resources in a holistic type of approach, meaning not through medication, where you can work on living your happiest and healthiest lives. So our Viva Resource Center locations, they're fully equipped with different types of consultation rooms. There are classes that you can take part in. These include things like yoga, meditation, there's sound healing classes, there's Zumba workouts, and so many other different classes. We actually post our class schedule at vivaresourcecenter.com. You can take a look at our class schedule. There's both in-person and virtual classes that you can take part in. So you can either come to one of our facilities or you can actually do it right from the comfort of your own home. There's also at the physical locations, there's exercise equipment there. I don't want you to think of it as like it's just a gym, like a 24-hour fitness or an LA Fitness or anything like that. But there is exercise equipment in there like ellipticals, treadmills, free weights, things like that. We do offer one night where you can come in and work out freely, but more often than not, it's through an entire program using the exercise equipment that's in there. There's also massage chairs in there as well. You can try acupuncture for the first time. They'll actually do it in your ear. And all of this is at no cost to you. And then we even have full-size kitchens in there where we do healthy cooking demonstrations. And we can actually record those and you can actually take part in any cooking demonstrations that you would like to take part in. They make really delicious and nutritious meals. All of this is included at no additional cost to you. What I am excited to announce, though, is that we are expanding. So right now, we currently have 3 different locations. We have one in Hotel Circle South, which is in Mission Valley. Then we have another one in the Kearney Mesa location, and then we have one small satellite location in the Carlsbad region. But we are excited to announce that we will be opening a resource center in the Chula Vista area. This is going to be in Q1 of 2026. We'll make sure to provide you a notification on how you can go ahead and access the resource center, when it will open, and all the services that it has to offer. So I believe that's going to be located, I want to say, around H Street and Broadway. And so we will be providing you with further communication. We have a lot of VIBA members that live in the South Bay region. So it makes sense to have one of our resource centers located in that Chula Vista area. If you are accessing the VIBA Resource Center and you want to speak to an individual on whatever well-being challenges that you may have, whether it's physical, mental, social, emotional, like I had mentioned before, then we do have care navigators. They're basically nurse practitioners that can assist you with any of those well-being challenges. They will work one-on-one with you on developing a program that works and fits your lifestyle so that you really can live your happiest and healthiest lives. So if you do want that one-on-one support with someone, then we do have that available, and you can go to vivaresourcecenter.com to go ahead and schedule an appointment. Through the VIBA Resource Center, then, if you're working with one of our care navigators and you want to dive a little bit further into wellness, then we do have 8 dimensions of wellness. We want folks to be able to live their happiest and healthiest lives. And we've divided that up into 8 pie slices or 8 dimensions of wellness. I'm not going to go through each one of those here, but where we see that some folks are striving in certain areas, maybe you're someone that is really good at working out, eating healthy and right, we might find that there might be other challenges that you may be having. Maybe you have a hard time working in your environment or socializing with your community, things like that. We want to make sure to provide you with all the different resources that are available. And so you can simply register for this program. It's a 6 class program that's available, and I believe each session is about 1 hour. And we just really go over all the dimensions of wellness and how you can live your happiest and healthiest lives. Again, this is going to be through the Vivo Resource Center. We have a section on the whole health coaching program. If you're interested, just feel free to contact us. We do understand that sometimes, life faces us with challenges where they may impact us. These could be major life transitions, or, navigating life transitions, and you need additional support. We have that available to you. Maybe you're preparing for marriage, or you're expecting your first child. Maybe you're going through any unforeseen circumstances. Maybe it's you're going through a divorce. Whatever it may be, if it's a life-altering change, we want to let you know that there is support through the Vivo Resource Center as well. We have counselors that are more than happy to go over, preparing for those type of transitions and help you go through it. So there is that additional support for any life transitions that you may be experiencing. And then finally, we have our cooking and nutrition hub. So as I mentioned before, we do have, full kitchens in our Vivo Resource Center where we do perform healthy cooking demonstrations. We do record all of our classes. You can view them through the Vivo Resource Center. All of our archived recipes are on there. It's performed by our very own Chef Leslie. She's absolutely fantastic. I don't know how she does it. She can take broccoli and make it taste like bacon. So there's so many great recipes, and we've really learned that providing yourself with nourished and nutritious meals really go a long way when it comes to your overall health. So again, this is all through the Vivo Resource Center. You can take a look at all the additional support. It's all at no cost to you, as well as your covered dependents. Finally, before we wrap up, I'm just going to touch base on some of the additional benefits that you have. This is in addition to being enrolled into the SIMNSA plan. So the first one is going to be our advocacy department. They are probably one of my favorite departments that I work with on a regular basis, and they really are here to advocate for you. There's a lot of questions that come surrounding your healthcare benefits. What's covered, what's not covered? Why am I receiving this bill? How come I can't seem to get this referral pushed through? They are here to advocate for you. They work Monday through Friday from 8 a.m. to 5 p.m. And there are in-house dedicated team at Viva that are here to advocate and help you get the answers to the questions that you have. Maybe you're having a hard time with access to care or the quality of care you're receiving. They can assist you. They can work on the back end with SIMNSA on any questions that you may have. Was that service covered? Was it not? What's it going to cost me if I go here versus here? They can assist you with all that information. The next benefit is going to be through Teladoc Medical Experts. So this is a second opinion program. Basically, if you're undergoing any type of aggressive surgery or you've been diagnosed with a chronic condition, before you go through treatment, maybe you want to get a second opinion. Make sure that the treatment option you're receiving is the right treatment option. Well, that's exactly what Teladoc Medical Experts does. Basically, you can reach out to them. I provided their 800 number as well as their website. Call them and you'll have an initial consultation with whatever it is you're going through. I'll give you an example. Maybe I'm someone that needs to have my knee replaced. Before I have that knee replacement surgery, then I can reach out to Teladoc Medical Experts, let them know that I need to have a knee replacement. They're going to have that initial consultation with me. After that, then with my permission, I can share that with them, whatever medical records that I want to share. So that includes, communication that you've had with your doctors or your surgeon. If there's any type of lab work that's been done, x-rays, MRI scans. And what they're going to do is they're going to take that information, they're going to send it up to one of their world-renowned doctors. They're going to look for a doctor in the area of expertise of whatever it is that I'm going through. So in this case, it would be a world-renowned knee doctor. And they're going to meet with me and they're going to see what their findings were. Am I getting that right diagnosis, that right prognosis, the treatment options that are available? Maybe that surgery I'm about to have, maybe it's an outdated surgery, or maybe they find, you know what, you don't actually need knee surgery at all. This is entirely from something different. They can even communicate that with your doctors or surgeons on what they're finding. But what it really does ultimately is it provides you with that second peace of mind, knowing that you are making the right decision moving forward. And whatever decision you decide to make, you feel confident that you are making that correct one. Again, it's available to you and your dependents at no additional cost. And then finally, not only do we want to take care of you, we want to take care of your four-legged friends as well. So if your canine or feline is taking any type of medications, there's a good chance that we can save them money. You just simply go to insiderxpets.com/pets. You can go ahead and register, and then you will have an ID card that you can print out. You can take it to one of their 40,000 participating pharmacies, and you can get a savings on your prescription drugs for your pets. You get an average of 77% on generics and up to 15% on any brand medications. And I did check, unfortunately, flea medication is not included in this, but if your pet is taking any type of medications, there's a good chance that you might be able to save them some money. If you want to stay connected with us, then we are on all the social media platforms. You can go ahead and click on whichever one that you would like to be a part of. Basically, this is just so that you're in the know with VIBA, what's going on, what's being changed, what's being updated, things like that. We always want to make sure that you have the latest and greatest information. So if you are interested on being on any of the social media platforms that we have to offer, then feel free to scan the QR code and you can go ahead and register. Finally, I just want to reiterate some of the additional resources. So you have access to our advocacy team. You can go to vibaonline.com/contact, or you can reach out by the 800 number. And that is for any questions pertaining to your benefits. We also have our carrier contacts on there as well. So if you need SIMNSA's phone number or any of the additional resources, our phone numbers are listed on this site as well. And with that being said, that does conclude our presentation today. We really appreciate all of you being here today. We'd love to hear your feedback, whether it's positive, negative, any questions that we might be able to answer. We greatly appreciate it. I did put in my contact information as well. I am your dedicated account manager with VIBA. And so if you do have any questions, feel free to reach out to me. I'm more than happy to assist. With that being said, that does conclude our presentation. We really greatly appreciate your time here today. Thank you so much for joining us. Would like to go ahead and thank the County of San Diego for allowing us to be here today to present your open enrollment. I'd also like to thank Esmeralda for going over all the wonderful benefits that SIMNSA has to offer in your plan design. And just to each and every one of you for joining us here today, we really appreciate it. Thank you so much, and I hope this was information or very informative for you.
Thank you, Matt. We actually do have a couple of follow-up questions. It's going to be both for you and also for Esmeralda. When it this would be circling back to the first part of your presentation where you had talked about the new SB 729, and
Mhm.
if a county employee did decide to continue with Kindbody, and that 20% discount for the fertility services. So if they enroll in the SIMNSA plan and they want to continue through Kindbody, can you just also clarify whether or not they would get the 20% discount for those fertility services?
Yeah, absolutely. So basically, the way that it's going to work is if you are accessing Kindbody in the 2025 plan year, VIBA will pay and sponsor one full kind cycle. So that's basically a round of IVF or a round of IUI. Let's say you're going through that process in 2025 with Kindbody. You move into the 2026 plan year. We're awarding you with that continuity of care. So if you're still accessing services in 2026 and you started your fertility quest in 2025, you have that first quarter, so up until the end of March, to access those benefits that were covered in 2025 through quarter one of 2026. beginning of 1/1/2026. So let's just say you want to wait till after the new year to grow your family or use your family. That's going to transition over to your medical plan. So in this case, it would be SIMNSA. So if you're looking for any type of infertility treatment to be covered under your plan, that's going to be directly going through SIMNSA. However, if you want to use KindBody and you start in 2026 for infertility service, so IVF or IUI, then you can go ahead and use KindBody. You're just going to have to pay out of pocket for that service. Now, we do provide you with a 20% discount, but you will have to pay out of pocket to utilize their services if you begin your fertility quest in the 2026 plan year. You do have access to all the additional resources that I had mentioned to, like Kind Man, Kind Doula, the menopause benefit, the holistic services, the fertility preservation. Those are covered and paid for and sponsored by VIBA into the 2026 plan year. But if it's for IVF or IUI, then if you wait until 2026, you're actually going through your plan provider, or you can go through KindBody at a discounted rate. I hope that helps clarify.
Yeah, thank you. And then another follow-up question regarding the VIBA resource centers.
Yeah.
How would a person register for classes if they wanted to utilize the resource centers?
Yeah, fantastic. You just simply go to vivaresourcecenter.com and you can go ahead and I'll put that in the chat here for you guys.
Okay.
But you can see our class schedule. There's virtual and in-person classes. Sign up for as many of them as you would like to. They're all at no cost to you. We just verify that you are a VIBA member, basically showing that you're enrolled into the SIMNSA plan, and you have access to all these resources at no cost.
Thank you. And then the next question is likely going to be for Esmeralda. If an employee travels internationally, and we'll just use an example as in Europe, how would emergency services work there? And then does SIMNSA have on their website like an emergency line that they can call? Like some other networks will have like a travel line available. Does SIMNSA have something like that for employees to access while they're traveling internationally?
So we do have that 1-800 member line services that is available, and we are open, they can speak with anybody 24 hours a day, 7 days a week if they're, for example, traveling internationally in Europe. So they can certainly call and say, we're in Europe, but specifically emergencies in Europe may be handled differently than how the claims process is in the United States. So depending on their healthcare system, typically a member would probably need to pay up front and submit a claim after they return back to the US. That would be handled differently, and that reimbursement would probably need to go through our Mexico team, and they would go to Mexico and provide all of their receipts for that emergency, and then that they would be reimbursed after their applicable co-payments on their plan.
Okay, thank you. And then Esmeralda, I know
Yeah.
that you said that an employee wouldn't need to take their claims to a facility in Mexico. I can't remember. Is there a local office also where a member would be able to walk in and get like administrative help? Is there something like that available in the US?
Great question, and great. So we do have our Chula Vista administrative office open Monday. That is where I work from Monday through Friday from 8 to 5 p.m. If a member needs, for example, help with a hospital claim or a bill that they receive for an ambulance charge, they certainly can come into our office and speak to somebody. That's really unheard of nowadays. You don't really see that. They can walk in with that bill, and somebody here will help them with that provider from that provider bill from the ambulance or hospital, and they can certainly give them that, help them with that and get a callback number so they can get so we can review that claim and then provide status for them with and an update. Correct, because I know it may be scary and daunting when you get those bills from the hospital or ambulance. Correct. Thank
All
you.
right, awesome. Thank you. All right, I don't see any other questions coming in the chat. If anybody has anything they want to type in there really quickly before we let Matt and Esmeralda go, of course, you still have the opportunity to ask us questions after today's presentation. You're more than welcome to email us. Matt, I believe, put his own contact information in there. And then Esmeralda also mentioned that there's a dedicated number to call for customer service if you have any questions about the plans. We do have information posted on our open enrollment website for all employees to reference. So that's also a resource for them. Okay, I don't see any additional questions coming through the chat. So at this time, this does conclude our seminar. Thanks again for joining us and have a great day, everyone.
Thank
Thank you so much,
you.
everybody.
Have a great day.